Good morning, everybody. Can everybody hear me okay? Terrific. So I'm going to take about 10, 15 minutes, and it's going to be a combination of trying to convince you that patient experience is really important and convince you that it's actually a really key part of how we should think about quality. And when I give versions of this talk to my physician colleagues, there is deep skepticism in the room. Because there is fundamentally a question of, what do patients know? And when I think about this question, why should we care about patient experience? I think about it in several ways, and let me just get us started. The first is I would argue that patient experience is important unto itself. It's an end goal of healthcare. It represents facets of care that only patients can report on. If part of why we went into medicine, why I went into medicine as a physician, while those of you who are nurses, you went into nursing, if part of the goal was to relieve suffering, there is nobody else who can tell you whether you have managed to do your job than by asking the patient. You can't get it from the doctor, you can't get it from the statistics, you have to ask patients. It's a fundamental part of why we do healthcare. It is to relieve suffering, and there's only one source of knowledge about suffering, and that's the patient. There's a second reason to care about patient experience, which is there is now lots and lots of evidence there are important downstream effects if we care about patient experience. We know that we can come up with the best diagnoses, we can come up with the best treatments, and we can hand it over to the patient, and if they don't take the drug, nothing works. And lack of adherence, lack of people taking their treatments is a huge issue in healthcare. And there's very good evidence that when patients have bad experiences with their doctors, with their nurses, their adherence rates plummet. And so if we want to be effective in our job, and if we think that our job does not end with just writing the prescription, but our job is to make people better, then we have to care about patient experience. If we want patients to be engaged with their health care, if we want patients to actually think about what's happening to their own health, we have very good evidence that when patients have a bad experience with the healthcare system, they're much more likely to tune out. They're much less likely to come back. And fundamentally, patient experience is about trust. And one of the things that we have seen in health crisis after health crisis, whether it's been in disease outbreaks, actually I would argue probably the biggest failure that occurred in West Africa with the Ebola outbreak was a fundamental lack of trust that people had with the healthcare system. And so when they got sick, they did not go to the healthcare system. Why? Because they had had consistently bad experiences. And when you have a bad experience with an institution, you do not go back. And so if we think about the importance of patient experience as a fundamental part of building trust in the community, that becomes another reason to care about this. And this is why every august body, from the Institute of Medicine, when they define quality, they have a multifaceted approach, but patient-centered is right at the heart of it. You can't have high-quality healthcare that's not patient-centered. This is from the Institute of Medicine in the United States. If you go to the NHS framework, National Health Service in the UK, you see patient experience as one of the cross-cutting domains, ensuring people have a positive experience with care. If you go to the World Health Organization, the goal here is not to walk you through every single possible definition of quality. It's just to say everywhere you look, you see the same set of issues. It's about responding to people's preferences, coordinating their experiences, ensuring they have acceptable quality. So there is universal consensus that meeting patients' needs is a key goal of healthcare. It is the key to relieving suffering. And that, to me, suggests that you can't be a practitioner. You can't care about effectiveness without caring about patient experience. So what's the concern with patient experience? Why is it that when I talk about this in the US, when I talk about this in the UK, I spent yesterday speaking to healthcare experts in Hong Kong, why are people concerned about focusing on patient experience? It's because they feel there must be a tension with more technical measures of quality. Clinicians and policymakers worry about trade-offs, and I'll explain what I mean by this. They worry that patients can't judge objective quality. What does a patient know about whether I got the diagnosis right? What does a patient know if I gave him or her the right treatment? They didn't go to medical school. They didn't go to nursing school, right? People worry immensely that doctors will focus, if we make patient experience central, doctors will focus on pleasing patients, but not providing evidence-based care. And it will worsen outcomes. This is a broadly held belief. It's certainly a broadly held belief in the US. It is a broadly held belief in the UK. And I would not be surprised if it is a broadly held belief in Hong Kong. People worry a lot about this. Consumers, of course, are not so worried about this. And most consumer advocates argue that consumer advocates argue there need not be trade-offs. That doctors and hospitals should be able to provide technical quality and patient experience of this. So now I'm going to get into the really nerdy part of the talk. I'm going to take about 3-4 minutes and show you a bunch of data. Okay? And I'll go through it reasonably quickly. I'll spend a little time on the first couple of slides, but I will try to show you what the data is, or the data are, in terms of trade-offs between technical quality and patient experience. Because the data are not subtle, they are not mixed, it's decidedly one-sided. Here's from one paper, patient experience in US hospitals. The worst hospitals in terms of patient experience, the best hospitals are down here, and I'm going to show you how they perform on clinical guidelines for acute myocardial infarction. And what you see is the best hospitals on patient experience also have the best scores on clinical guideline adherence. That's true for congestive heart failure. It's true for pneumonia. It's true for surgical care. What you see consistently is that the hospitals that have the best patient experience are also the ones that are the most adherent to objective measures of clinical practice. The better the reported patient experience, the lower the mortality. And what's interesting to me is that the data that comes from patient self-reporting seems to be a little bit of a better predictor of mortality than the data that comes from formal surveys. They both matter. Don't get me wrong, formal surveys are great. But the self-reported data tend to be a little bit better at predicting mortality, predicting readmissions. That's from the National Health Service. So this is not a place where some studies show this and some studies show that. The studies are pretty uniformly one-sided. And so if we're going to be evidence-based, I think we can feel very comfortable that focusing on patient experience is a really good place to start. So then a reasonable question would be, how well can we measure this? And one of the points that Shalini made that I want to just reemphasize, that it isn't just about measuring this. This is what people usually think of. We're measuring nice lobbies, we're measuring nice food and parking. No. It's not about, so one thing I distinguish is patient experience versus patient satisfaction. They're not the same thing. It's not about good food, it's not about good lobbies. So what is it? We're measuring what matters. We're asking questions like, were you treated with dignity and respect? Did people communicate effectively with you? Did you have your needs met? So these are much more specific questions, and these are the questions only patients can answer. Let me take 2 more minutes and then I'll finish up. You heard this alluded to earlier. It's very important. Consumerism outside of healthcare is ubiquitous, right? You probably saw a version of this slide in Shalini's presentation. Here, by the way, is the #1 rated hotel in Hong Kong. Pretty impressive because there's some very nice hotels in Hong Kong. And what you can do is you will get data, right? It's worth every penny. And here's the general manager saying, thank you very much. Technology as a way of interacting with your consumers, with your customers is widespread. Here's the #2 restaurant in Hong Kong. And here's somebody who did not have a great experience. Food was really tasteless and no presentation at this reputable Chinese restaurant. But that's not the interesting part to me. The #2 rated restaurant in Hong Kong And here's what happens next. The general manager says, I have personally brought it to the attention of our executive chef and our culinary team for immediate improvement. We have no idea if that customer was a foodie, was a critic, or a major newspaper, or just somebody who happened to be in Hong Kong for a day and went there. And more importantly, it doesn't matter. It doesn't matter if that person was an expert or not. And this is beginning to change the behavior of every other industry. And there is no reason to think it won't happen in healthcare. It's starting to happen. Here's Dana-Farber Cancer Institute. This is the Cancer Institute affiliated with Harvard Medical School. And, gets about 4.5 stars. I wish it was 5. But the point is that this is becoming ubiquitous. And the thing I say to my colleagues over and over again is fighting this trend is a losing battle. The idea that somehow we can live in an age where the doctors and nurses and the hospitals got to decide what was good for all of you, and I got to stand up here and say, trust me, I'm a doctor, I went to medical school, I'll tell you what's good for you, is completely unrealistic. It's not going to happen. So we might as well get on board and figure out how to use this force of consumerism for the good as opposed to fighting it. So I think our mission, my mission as I have worked with the Hospital Advisor, is we need to begin to engage patients into healthcare. They're going to get engaged one way or the other. We need to use scientific and validated approaches. We need to measure what matters. And we need to make patients real partners in health. And if we do all of this, there is very good reason to believe that it will lead to better care and better outcomes for all of us. So on a personal note, I just want to say I was thrilled when a year ago, and I didn't realize it was a year ago, when Shalini reached out to me. And I took that phone call because Amitabh Chandra, the colleague that she mentioned, is a close friend and a terrific guy. He said, you should speak to Shalini. And I said, okay, I'll speak to her. So I took the initial phone call because of him, and everything I have done since then is because of her and her team. What they are doing with Hospital Advisor, I think, is transformative. I think it will not just have a big effect for the people of Hong Kong, it will have a big effect for people, I think, around the globe. Our job is to do as good of a job as possible to make it useful, to make it valid, to make it a tool for improvement. And Shalini, thank you for including me in this process, and I'm thrilled to be here. Thank you all for listening.